Emergency Medical Services Council meeting. When I call your name, please say present or here. Jason Zimmerman. Chief Grace Cacciola. Bradley Kaufman. Andrew Dahl. William Goffin.
Yeah.
Danny Mizels. Max Goldfarb. John DiGregorio. Ed Jarvis is here. James Pointer.
Present.
Gerald Gelbard.
Present.
Dr. David Benelli.
Present.
Michael Riola. Mordecai Lax.
Present.
Martina Baccarella. Marie DeGlio.
Here.
Nancy Benedetto. Arthur Cooper. Robert Krupe.
Present.
Megan Kessel. Manfred Fuchs. Benjamin Fay.
Here.
Michael Combs.
Here.
Eudigia Langsam.
Present.
Brian Levinsky.
Present.
And Dennis Laurie. So you got. Oren Barzilay. Sorry, I missed one. Nope. That's probably why I missed them. I didn't see. You have 20 people here. You have a quorum.
Thank you very much. Next item on the agenda is the approval of the November 26th meeting. You received the minutes in the mail. Are there any comments, corrections, discussions?
Motion to approve.
Motion to approve, thank you. Second, thank you. People are in a rush, I see. When I came in the parking lot, he says he closes at 7 o'clock.
Yeah.
Yeah, okay. All in favor? Any opposed? Any abstentions? Please mark the minutes as been established unanimously. Next item is the correspondence report, and Marie has graciously agreed to read the correspondence report.
Okay, the offices of the council received the following correspondence. For membership, Martina Baccarella and Dr. Joseph Schenker have requested to be excused. I know Dr. Schenker is in Israel right now doing some ambulance training. The fire department, EMS, sent us information on the FDNY Search and Rescue Field Medicine Symposium that will be held on April 24th through 27th. We have the address for registration, and I believe it is also on the REMSCO website. The following come from New York State Department of Health. They are enforcement actions. There are a few from here, so listen up. Ariana Mortensen, Albany, revoked and a $2,000 civil penalty. Empress Ambulance Service, Yonkers, was assessed a civil penalty of $20,000 for violations of 821, 22, 23, 24.
Would be nice to know what these are.
Well, we could look them up in Article 30 if you want to know them.
Anyone know?
Not off the top of my head. Don't have that committed to memory.
No.
We didn't have to pay
Staff
for
to
it,
bring
so
a
don't worry
copy.
about it.
Some people might want to know what to look out for.
We'll ask Michelle
Yeah.
for the next meeting. I know she generally comes with a copy of Article 30 in her notes. Okay, Lindale Brunson from Elmont, New York, has 3 years probation effective January 6th and a civil penalty of $2,000. Steven Stinson from Niagara Falls, suspended for 1 year. And suspension is stayed pending successful completion of a 3-year probation, which I understand probation is not remediation, it's just not getting in trouble for 3 years. Assessed a civil penalty of $4,000, but that was reduced to $2,000. Carol Attar from Woodhaven, New York, suspended for 1 year effective November 26th. Civil penalty of $12,000. Of that, $10,000 is stayed pending no further violations during the time of probation.
I'd love to know what she
Yeah,
did.
that's a really big civil penalty. I'd like to know how the Department of Health decides on penalties.
They don't.
They don't?
They don't.
The administrative judge does?
Yes.
Okay, well, where does the money go? To the general fund? Sorry. Kadisha Garcia from Brooklyn, New York, suspended for 1 year, effective 11/26 for violations of Part 816. Suspension is stayed pending successful completion of probation. Christopher Pylock from Farmingdale, New York, also suspended for 1 year. Suspension is stayed pending successful completion of 1 year probation. John Keever, Worcester, New York, revoked. And civil penalty of 2,000. James Kozak from Oakdale, New York, revoked. Revocation is stayed upon completion of 1 year suspension and 3 year probation and $2,000 civil penalty. And this one hits close. Corona Community Volunteer Corps is no more. It has been revoked. Effective 12/2/24 for violations of Article 3012.
You have more pages of revocations than I do.
Yep, so I don't know. They didn't copy it on both sides for you, sorry.
Apparently not. Okay.
So it's good I gave the report. There are a few people from this vicinity, so you should take a look. We could send this to you directly or take a look at the enforcement actions on the DOH website. That you should already have the direct address for. If not, go to the REMSCO webpage, it's all there. We received nothing from New York City Department of Health. For our ambulance agencies, we received an announcement from Medicis Ambulance Group, which is also Jamaica Hospital, announcing it is opening its online medical control facility for the New York City volunteers. And we're very grateful to them. Right now, we are receiving the applications from the volunteer ambulance services as to which ones want to use the service. And this is a very good thing. We need more online medical control facilities. And Bedford-Stuyvesant submitted a notification to the New York State Department of Health, letting them know what type of BLS CPAP they would be using. It's not part of the state protocol, but it is New York City protocol for BLS. No information on course sponsors. There is a big list of CME training that's going to be on the New York State Vital Signs Academy. And they sound very interesting. Newborn assessment and complications of postpartum. Intro overview of the neurodivergent student, which I guess is a new problem for our course sponsors.
Before you move on, it appears that Bedford-Stuyvesant is asking for authorization from us. That's what the letter says.
It's in our protocol,
I know,
so
but they're asking to hereby request authorization
are they asking us?
to, dear sir and madam, and we are the New York City Regional Emergency
Oh.
Medical Advisory Committee. I guess that's us.
Okay,
I think
So-
REMAC needs to give them the.
So I think it needs to go to REMAC rather than to here. So it should be. I can't tell you.
It was already announced at the REMAC meeting last week.
It was taken care of.
okay.
Yeah, we received a letter from REMSCO.
Approval to use CPAP.
It's,
Deals.
it's part of the state requirement. Yeah, it's in our protocol, but the state requires them to go through the paperwork.
It's,
Yeah.
it's still a pilot project, so it needs to go to the REMAX.
So statewide.
It was
this-
brought up at last week's REMAC and read out at the correspondence report.
Yeah, it was brought up at the last meeting. I assume it was
Well,
approved.
that's IJET.
That's
IJET
IJET.
goes through that.
Oh,
I'm talking about
CPAP.
regular CPAP.
No,
That's in protocol. It's just notification. Yeah, it doesn't need any approval.
That's the confusing thing.
Yeah.
But that's still, you have to answer,
That's
whether it means anything or not. They've asked something.
Right, they got
You
the
have to say yes, no, or we don't care.
what?
They were already answered.
They can't do that. such a-
Good thing you did, you. They didn't need to ask. It's
But
a-
they did ask.
Great.
Therefore, the proper
God
thing
bless.
is to respond
Yes.
when someone
They got-
sends you an official letter.
They got it.
Yeah, I got a letter already, yes, I didn't have it.
I won't ask you who signed the letter, but okay.
Okay, so REMAC did
It was neither me.
respond.
No.
Michelle gave them a response.
Okay, good.
Okay,
There is, just on the side, and that could be a report as well, there's a major battle going on at the REMSCO about what they call scope creep, when BLS is getting more and more and more of what, I have no objection to it, but it just reverses when they got rid of the CC and cut it apart. Now they're going back, rebalancing. So I'm sure that's gonna be a major battle again at the floor of REMSCO in February.
okay,
Stay tuned.
so this has been resolved, okay.
Okay, so we're done with the,
Well, a few more things, okay, we received a request from the American Red Cross to assist with the development of a public service announcement on the New York City opioid overdose crisis. I think Joe may speak on this a little bit later. REMSCO was involved in that. And New York City REMSCO received a complaint regarding a New York City-based ambulance service running units with expired meds, equipment, and not meeting Part 800 codes. That was forwarded to New York State DOH BEMS.
a member of the squad, was a bystander, or how did this go on?
Let's see.
So it was a member of the EMS service that requested anonymity.
And it was forwarded.
It was forwarded to New York State, yes.
Okay.
Yeah, we try and, you know.
Yeah.
Okay, and, agendas, minutes, and associated attachments were mailed to members, and the Medicis online medical control agreement has been sent to all New York City volunteer ambulance service, and a correspondence report.
Any questions on the mail? Previously? Hearing none, we now move on to next item on the agenda, which is the staff report. So,
All right. So, the REMSCO offices continue to work on grant development for replacement and upgrade of the REMSCO regional radio channel. We do want to remind again, EMS services, that we are an opioid overdose prevention program, and we encourage all the regional EMS services to participate in the naloxone leave behind program. And if there's any agency that does need naloxone or a restock of it, we are able to provide that. As mentioned in the correspondence report, we are partnering with the American Red Cross to put together a PSA on the opioid overdose crisis and the EMS response to it. We'll actually be meeting with them in February, and there'll be a news vignette on WNBC that will be appearing on the news in February as well on that item. REMSCO staff, we are exploring grant opportunities to continue to support our EMS peer support and mental health team. And so we can provide additional training and resources to our EMS providers. We have submitted applications for fiscal year 2026 New York City Council discretionary funding, requesting support for our peer team. And we do ask our EMS services, if you have any relationships with any city council members, to give us a good word on that. Let's help give our providers the support that they need. We will also be partnering with the New York City Department of Health's hospital preparedness program to update our EMS infection control policies, and updating our policies, training, and equipment to meet new ASPR standards. Projects will include conducting a study on how policies and procedures have changed post-COVID, developing an updated infection control training module on the LMS, as well as running some train-the-trainer sessions, and doing PPE dissemination. So this is kind of a re-upping of the infection control program that we did back in 2015, 2016. Was wildly successful. But now that we're some 9 years later, we need to update it and get some new trainers. And that concludes the staff report.
thank you very much. Are there any questions from staff report? Hearing none, move on to the program agency update report. You're on again.
So the fiscal year 2025 program agency contract has still not yet been released, even though we are now 7 months into the deliverable period on that contract. We have reached out to our New York State legislatures that cover New York City, as well as the comptroller's office, requesting that they advocate with the governor's office to prioritize the processing of these grants. This affects not only us in our region, it also affects, aside from the council, it also affects the fire department program agency, as well as the other regional councils throughout the state. Many of which are smaller than this council and rely on their funding even more heavily than we do. So once again, if you have any relationships with your New York State legislatures, please advocate for this body. And then finally, staff, we are pre-preparing the materials necessary to voucher for the contracts once they have finally registered. And that concludes the program agency report.
We should hire a lawyer. Take an Article 78 proceeding against the state. Not doing their job.
We tried that. We brought that to the board.
Okay, any questions? Hearing none. We move to the ambulance committee report. Marie, you're on.
Okay. The ambulance committee met immediately before regional council. We have no applications for transfer of operating authority. We have no determinations of public need. We had 2 tag reports. One is security ID and vehicle tag. I'm going to give a brief info, and Jerry, if I miss something, please jump in. We've decided, we're recommending that the security IDs, there is no reason to use them anymore. When we first came up with these ideas was right after 9/11. The idea was to keep track of who is going in and out of MCIs, should we have another, major event. Since that time, we've come to understand that agencies going into and out of these areas are going to be people that were called for either by fire department, police department, or OEM. So they're the ones that will be allowed in. It doesn't matter what additional IDs they have on their ambulances. So we recommend that this is not an expense that we need to take on anymore. It's not useful. Also, for the photo IDs, the same reasoning goes by. When we first started, we wanted the photo IDs. We were going to be able to scan people in and out of scenes. Technology has changed, needs have changed. If you're not going into a scene as part of an ambulance, you're not going to go into the scene, and that is not up to council to tell you to stay in or out. That's up to the coordinating bodies, which will be fire department, police department, and OEM. So we recommend that we do not continue to do photo IDs for everybody in the city. Also, the liability of REMSCO identifying all these people and vouching for them when we really are not doing it on scene, knowing for sure where it's like the third party to a vetting system. So there is liability involved. What the committee did recommend is that for smaller agencies that maybe don't have the ability to make their own agency IDs, I mean, this is 21st century, every agency should have some kind of formal agency ID. But for those agencies that don't have that ability, we would provide them with agency ID cards using their templates for their agency. It would not say REMSCO on it, and it would be whatever small charge just to pay for the materials. So that then we'll be sending out letters to agencies asking if they have this problem.
But then we have to make sure that whichever agency is doing the coordinating recognizes those things. Because if some agency, let's say a big agency, says, I'm not letting in anyone other than that big agency, and you have 500 people showing up from the second biggest agency in the city, and they say, we're not letting you in because we don't know who you are, then we have a major issue. So I think that we have to make sure that whoever is, you mentioned Fidney, PD, they have to recognize the other agencies as being valid agencies, or you're going to have a big problem.
We have, go ahead, Jerry.
I don't think that's the real issue at hand of what the CAG was tasked with. It was really about, do we want to continue issuing REMSCO
I understand that.
or not?
Put that aside.
Either way, whether it's a REMSCO ID or ABC EMS agency, fire department under pre-hospital coordination resources lets in who they let in. They're the coordinating body on a mobilization, it's OEM. And whatever the agreements are, the agreements are.
Well, not
Whether-
quite,
Whether we have.
not quite, because the protocols, I don't want to go through the summer of, when was it? That there was that big meeting. There is now a coordination protocol that agrees that all of these agencies will be allowed to participate. So one big agency saying, no, you can't participate is a violation of that protocol. And there's going to be I'm trying to prevent a battle that there's going to be.
But I don't think us doing an individual REMSCO card or an
Forget
agency
about the
card,
REMSCO card. I
it's
moved
gonna
on from the
change it.
REMSCO card. I move on from the REMSCO card. Then the next project should be to make sure that whatever IDs the different agencies use
Mhm.
should be plastered up on a poster or something and given to all the people who are coordinating, that they recognize that this particular ID card from agency X is a valid card.
But they're coming with an ambulance.
Huh?
Yeah,
They're on an ambulance.
No, come on, you know, for real, I don't have to talk about a particular agency whose two major members are sitting there, who don't come necessarily on ambulances.
Dr.
That's-
Langston, we did,
That's a whole different ball of wax.
Okay, so
not
that's
the-
a
and
reality.
Not for here.
Okay,
Yeah.
I was there at 911. I saw what a mess there was. I drove my private little car into a private, into the staging area right in front of the tunnel. Okay, no one said boo to me, period. I could have been a terrorist. And no one said boo to me. And I got out of my car, I hopped on another ambulance and drove through the tunnel. And no one said anything. We have to prepare. You think it's not gonna happen again? It'll happen again.
Dr. Langston, the issue is that when it comes to setting up and staging, it's not REMSCO who has the authority to tell the stagers, which are,
They
The fire
remember that
department-
it was REMSCO that passed together with all these agencies, the coordinating of resources protocol.
I know,
And
I,
agreed that we should still, and we still need to do that, the coordinating of all the resources. I'm not saying, I'm sorry, I can't.
That's the mobilization agreement.
Yes.
and
We
that's,
have an MOU in place, so.
yes,
Again, it all depends who's controlling the staging area. And I can tell you, 9/11, the fire department was
Was
not
not.
controlling the staging area. It was federal agents. It wasn't even NYPD the whole time. So that's out of our control. But if we know when there's an MOU in place, the highest ranking authority for each agency are conducting meetings, and we would say, we have an agreement, A, B, and C are going to come in and assist us within this area. So I think we're driving ourselves
Yeah.
crazy because we don't know what's going to happen at that moment, and we're going to have to deal with the issues at that time. But there is an MOU in place.
yes, and we are reviewing the coordination of pre-hospital resources. We actually gave it a brief overview. It looks like it still is intact. It works fine. But the MOU is going to be looked at and
That's what I'm
probably
saying.
rewritten before.
It's not gonna cover.
Get an MOU in place
Well,
with the volunteers.
Mhm.
Taking a look at the issue we had last year.
Yeah, but that's for routine day-to-day use. This is not mutual aid as in Article 30. This is mutual aid response for disaster in New York City. And that's the document that has been in effect since after 9/11.
Yes.
And we need to update it because there are pieces in there that are just equipment
And
needs
that
and all
needs
that.
to be done. As
Yes,
part of that, identifying all the legitimate participants in the system.
but that is part of what It is, because once we get everything signed from each individual agency, those names go on the list, and that's, yeah, that's shared with fire and OEM. Not so much PD, because we don't deal with them.
Right. So let's just comment. If we're talking about a major disaster response, I think whichever overseeing agency is managing the response should be welcoming any agency that's willing to help. As Jerry mentioned, I don't think an ID card from one specific committee or agency is going to change who's going to be willing and able to help. However, if God forbid, an event happens, yes, Sulla's 1,600 volunteer EMTs and paramedics will be glad and will be responding, and hopefully will work in conjunction or tandem with the fire department, and will every other agency. So whether we vet them out properly in the beginning and we give them an agency ID card, of course, they should be showing up on scene and, checking in, etc. As Chief Caggiolo just mentioned, I think the MOUs for all the volunteers or all the agencies that may participate is important for what Dr. Latham was mentioning about the pre-hospital coordination of resources. So I think we're all saying the same thing. And in light of what we just heard, that, the other largest agency is going to be losing 1,700 providers, I don't think any one agency is equipped to handle a major response. So the MOUs of all the volunteers and agencies is probably of utmost importance. On that note, I have yet to ever receive an invitation of an interagency training or coordination, but more than glad to participate.
Anything else? We will update you as to what the committee has worked on with regards to the MOU. And anyone else who's interested in participating in this discussion, please let us know. And that's, okay, so that's the end of that report. You don't have anything else, right, Jerry? Good. Our next report is from recruitment and retention. Michael Combs, I'm gonna let you give this really quickly.
Yeah, sure. In addition to, we pulled a lot of the EMTs and paramedics throughout the city to figure out kind of what would help with their views of recruitment and retention. And a couple of things came up were like retirement planning resources. And so we reached out to one particular company, it's a large company, and they're willing to kind of sit down and have a Q&A and a presentation about the different types of retirement plans, what a Roth IRA is, what a traditional IRA is, 401ks, things like that. When you can pull from some, when you can't, tax implications and things like that. A lot of our EMTs and paramedics are young and seems very daunting. And so people just kind of push it to the side and don't do it until then it's too late. And maybe not too late, but later on, and they could have capitalized on investing earlier. We're going to make sure that disclaimers are in place to make sure that REMSCO is not promoting one particular company. And that way, it doesn't really, we're just pushing somebody's company. We also have letters going out to a list of DOE schools that have allied health programs and a focus on healthcare careers in healthcare. And we're going to kind of have a request to participate in their job fairs and whatnot going on in the year. And then lastly, as Marie mentioned earlier, pay is the number one lever that, if we could pull, would help with recruitment and retention. The fire department mentioned earlier about a big firefighter classes that are coming up, and they're going to lose a bunch of employees to the firefighter. So next, our tag is going to talk to some of our elected officials about Medicare reimbursement rates, funding, and explore some of our options on how to increase wages for our EMTs and paramedics. Yeah. Any questions?
Thank you, Ms. Combs. Okay, and Joe Ranieri reminded us that, I don't know if you handed it out here, the REMSCO EMS Awards. What day is it again?
Sunday, May 18th.
Okay, and the awards have to be voted on at REMSCO at the March meeting.
Yes. Yeah, we're moving up the timeline for the issuance for the announcing the awardees to give them more time to prepare to attend the event and have their agencies participate and whatnot.
So please get your nominees in. There are a lot of people in New York City that deserve to get awards. And generally, nobody from New York City goes up to Albany or gets any awards from them. So we need to give ourselves our awards. I have to get my dig in every meeting. Also, I think we mentioned it before as part of correspondence, but Jamaica Medicis has stepped forward to provide online medical control to our volunteers, and we're very grateful to them. And we'll be able to give you more information at the next meeting as to which of the volunteers are actually going to be utilizing that service. East Midwood is.
Sign the papers.
We're gonna credential a couple of their physicians in March.
You're doing an online medical control. Excellent. And that's the end of the ambulance committee report.
Are there any questions for Marie? Thank you very much. Now move to the training and education committee.
All right, training and ed met on January 3rd. There's a number of items we discussed. I'll try and run through them as quickly as possible. I think first and foremost, the biggest agenda item is something that the region has been dealing with for a while. REMAC and all of its subcommittees kind of tasked us with looking at stroke education. I actually met with some of the folks at DOT that are working on some of the AV. They're actually close to the end of development of one. They're going to share it with us. We're going to write the exam for it. We're going to share that with them, and we're just going to kind of use the same one together. So that hopefully should be up and running by the end of February, which was our anticipated time. I believe the fire department's timeline is about 2 weeks from now, so we're in good shape for that. We have a regional faculty tag that is part of training and ed that has been looking at scheduling different courses for instructor level training, and the two primary ones are CLI and CIUs. So instructor, lab instructor classes, there will be 2 per year. Next one will be sometime in the spring, which we're working on finalizing. The other one, fall, winter, and there'll be CIUs, which are instructor updates. It's kind of like instructor CME that instructors need to have to be certified. We've been trying for a while, and finally we're able to speak with the right people and got our first edition of the fire department journal, the monthly journal that was coming out. So that's going to be getting posted to the LMS. It's great, easy CME to access. So anybody in the region will be able to access that as well. And it looks like we have the right links in place to continue to have that flowing. We also provided to, we reported at QA about some data that we were able to acquire from a survey that we put out during the last training on the LMS that was discussed. I forwarded also to Dr. Lai after that meeting, and Dr. Lai is looking at that protocol to see if there's anything actionable on there for the region. And the last big thing I think that we have is we're going to be looking to clean up the LMS a little bit. It's been a couple of years since it's been up there, and there are some providers that probably have probably multiple duplicate providers, because people, after we started it, probably opened their own accounts based from links that were sent out. And this is after we had actually already imported everybody that the state had listed. So I'm going to do some cleanup there. And the other thing we're going to ask is for agencies to take a look and clean up as well, because while somebody might have an LMS account, the agencies that they're affiliated with are bound to change every now and then. And so that will need a little bit of updating. And our next meeting is going to be on January 31st.
Question, when will the next paramedic protocol update be ready to
So
use?
there are no protocol changes to do an update on.
Okay.
There are no protocol changes out there right now for us to do an update.
Right, but we did say that in order to redo, everyone would have to do one yearly, whether it was protocols or general.
So right, so yearly was the request. We're working with CNC to see whether we actually have to have one annually or there just needs to be regular updates based on
I
that.
thought we
But
said,
Dr.
I thought CNC wanted them annually.
So
I
Dr. Barber
went
did-
that not to do it annually, believe me.
Dr.
but-
Barber did mention that, and we did ask that we come up with something, but we haven't had that conversation.
Okay.
yet. So in terms of update, it's not gonna be an update, it'll just be an annual training because there's nothing to update on.
So let's get a date down. Either yes or no, no date is fine too.
Yeah, right now, there's no date because I don't even know what.
Yeah, but someone's
what
gonna have to
the
be
question is in.
someone's gonna have to be re-credentialed, and then all of a sudden, you don't have your CME.
It's not gonna slow down re-credentialing, this
Okay.
CME is, it's not gonna affect re-credentialing.
Okay. Any questions? Thank you. Thank you, committee. Moving right along. The REMAC.
Okay, so, good evening, everyone. The REMAC met last week in this location in person. There was a couple of items that were approved. I'll go by the order of their approval. So the first item was approval to changes to section 2 of the REMAC online medical control position in the New York City REMAC requirements for provision of ALS care document. Essentially, the changes were about the requirements for physicians in their first credentialing process and then in their re-credentialing process. There was a very lively discussion with opinions in different directions as to what requirements and which courses are required in order to be re-credentialed. It seems that there was in the end a compromise that that everyone agreed upon. The main sticking point was about trauma, about ATLS, whether it's required or not. And there was a proposal that was approved that an equivalent is acceptable. Then we moved on to the protocol committee where there were discussions, a couple of protocols that were brought as second motion to REMAC. The first one that was approved were changes to the FDNY hashtag protocols. All the protocols in the FDNY hashtag, all the changes to the FDNY hashtag protocols. Again, let me repeat this hashtag. EMTs and paramedics are specialized group of paramedics and EMTs at FDNY under EMS Special Operations Command that are highly trained in accessing and caring for patients in hazardous material environments. They undergo an extensive training of about 4 weeks. They have dedicated specific protocols that only they are permitted to use. They're very similar to the protocols that only rescue medics are allowed to use and ESU medics are allowed to use. This year, there were some updates to these protocols. None of the changes were substantive. Only changes really to formatting or being up to date with the New York City Unified Protocols. So those were approved by REMAC in the last meeting. Then there was a discussion about changes to the alternative treatment and alternative transport destination decision in the GOP. That was approved as well. Essentially, it was allowing any patient who was RMA to potentially be considered as the treat in place. And lastly, there was a discussion about changes to the altered mental status protocol. It was essentially bringing back to into the protocol to the CFR section. A part that was there in 2019 and was subsequently removed, and now bringing back again that allows CFR to give patients with concern for hypoglycemia to allow them to drink a sugary beverage or eat a sugary food sustenance in order to hopefully improve their mental status until a higher level of care arrives. There were representatives from the FDNY Firefighters Association who strongly opposed it. The motion did pass and the protocol change was approved. I expect that, similar to the mission fee that you were talking about, that will also be discussed in, that will also be discussed in, SEMSCO, CMAC and SEMSCO. I find it very hard to see that anyone would oppose for a firefighter helping someone to drink a glass of orange juice if they think that they're hypoglycemic. But, we'll leave that to CMAC. There were other items to be discussed, but then abruptly, everyone figured out that the garage, the parking garage closed at 7 and we lost our quorum and the meeting was forced to adjourn. Which again brings to the point that, you know, had we had a virtual meeting, possible, we would not have those issues.
The garage does not close. They tell you that, but there's somebody in the building that will open the garage for you, so don't limit your meetings.
That's
based
what
on
they
what
They told us that.
They told me the same thing.
Anyway.
Okay, but as far as that,
I hope you're right.
if everyone is.
Says they're very clear when
mentioned
I
this
answered the
business,
garage, they were closing at 7.
They want to close at 7.
Several people have mentioned me this business that we should start being able to have virtual meetings. Those who are for it, we need to contact the governor to have the law change. You know, we always say, you want to do, it, you want to do, it, you want to do it. So form a committee, write a letter to the governor, explain the reasons. And who knows? But right now, we can't do it. It's executive order, period.
Not sure it needs a committee.
What?
No, I'm not sure it needs a committee.
Okay, so you'll be a committee of one.
No problem. Give me your number.
He's the other one who I would refer.
This is a regular heated
Mentioned
discussion
that.
at the stage.
We've discussed this
So
for
the two
10
of you
years.
work together.
Can't get a meeting done in less than 2 hours. There's a problem with
Guys
that.
work together to get this change.
No reason. You know, and
So what?
you know, well, this.
I'll tell you the reason why, the one reason why. Okay, because coming from university setting, which we used to do this also. People who don't show up in person, don't show up at all, lose interest at all. You're sitting across the table, and I see someone make a point, I can tell them you're a jerk to his face. But they're not around, and they're on the screen there somewhere. And what happens in practice, I'm telling you, I'm not arguing. You guys want it, it's fine. Yeah, but I'm telling you that in practice, that's the reason why all these.
I understand the concern, but I think after running all.
I hear you, convince the governor.
And the protocol meetings all virtually and were very productive. I think that, you know, we can. do this.
Have a better attendance. Attendance is better.
Yeah, the attendance
The
is better.
reality is,
And
there
you
is
don't have to
some
even
level of conversation that is better in person. But the amount of people and where we're coming from.
You are correct.
And the timing of these meetings and a work schedule is for the people who
No,
are
you didn't.
actively involved in EMS in New York City. I think I'm speaking on behalf of the majority of them, it is very difficult and burdensome. And so I think that there's a immensely added value to have, whether it's part of the meetings or, you know, every other one. As an option to be virtually attended, as long as everyone accepts an adult and it's managed by someone who's leading the meeting, the committee chair, etc. That's like Natalie just said, we do protocol, medical standards where you've got 20 doctors who are fighting each other about medication dosages, but we still manage to get, you know, productive outcomes. So
You are correct. Now you gotta convince the governor. That's all.
And even the virtual meetings now.
Let's move on.
Posted publicly too. So,
That is correct. Okay, it is, the next REMAC meeting is on February 11th at 5 p.m. In person. And it is now 6:50, and since the garage might close at 7, I will end my report. Thank you.
The garage will not close at 7.
The last time it was this, they came down, they opened the doors. I'm not sleeping at all. Quality Improvement Committee. Charlie, what's up? You reporting?
Sure. So the Quality Improvement Committee met on January 14th. We we continue to focus on the regional implementation of the First Watch dashboard. We sent out a notification to all the First Watch users within the region with a short demonstration video and introducing them to the dashboard, how they can access it, how they can log in. And we are developing some instructions for helping users with their logins and their passwords, and for agencies to add new users to the system or to remove old users. We'll also be scheduling online information sessions that folks can, in town halls that folks can attend in person, where we'll be highlighting some of the individual measures on the dashboard. So for the Medisys group came and did a presentation on the BLS iGel supraglottic airway project. So we had also requested data from the other regional participant in the region, which was Ridgewood Ambulance, but they did not report any uses thus far. They did. So the Medisys group presented their QA data to the committee. So they presented their QA data to the committee. They found a low rate of complications with their users. The committee asked them a series of questions on some qualitative data that the Medisys folks are going to come back to the committee with. Let's see. For the New York City CARES project, the committee wants to encourage and facilitate agencies' involvement in CARES. We plan to collect data on which agencies are not yet participating and learn about the barriers that are preventing them from doing so. As Morty mentioned in the training and ed report, he presented data regarding the outcome of the LMS survey from the last regional protocol update, which highlighted some potential struggles that providers are having with certain regional protocol skills. So the committee decided that they'll have further discussion on that and see if we're going to put together a project around it. Our next committee meeting will be on February 13th.
Any questions? One comment I would just make is, would be a good idea. The committee does not have to meet on a monthly basis, the amount of work that it does. And it needs to have a set time, not that every single month it's a different time. People, again, some people, I'm sure some of you are very busy doctors, have your schedules made up for a year ahead of time. A committee that meets every month has to make up a new date for when it's going to meet. People can't be able to come to that.
Yep, we understand the struggles of that. We're working with the committee chair to try to resolve that.
Thank you for running the committee.
So
Okay,
one
next
item
item
under
is-
the QA committee, I'm sorry, Dr. Langston, one item under the committee
Yeah.
to bring up is that we do have a vacant seat on the committee now for a paramedic seat. Actually, I'm sorry, we have the RN seat is open. My apologies, my mistake. But actually, and we
join, someone sends a name to myself and to Dr. Schenker, we appoint them. It's not a matter of running or voting. We'll just get people. Thank you. The next item is the state
They need to be
EMS.
on council or REMAC.
Okay, state EMS report, the state, CMAC REMSCO met on December 3rd and 4th in Troy, New York. I have some rather extensive minutes. We're just going to hit some highlights. If anyone wants a full copy, just request it. We'll be happy to provide it. There were some approved CMAC REMSCO motions. I'll mention two. There was an approved motion for SEMSCO to send a letter to the Commissioner of Health requesting any health stability fund resulting from the managed care organization tax approved for the 2024-25 state budget that include funding for EMS sustainability initiatives. There's also an approved motion for SEMSCO to write a letter to the Commission Department of Health to advise on the key descriptions and elements of EMS as an essential service. The Bureau report that made mention of the Bureau of EMS developing new regulations for pre-hospital blood transfusions, which are expected to be released in early 2025. These regulations allow for ground and air ambulance to carry and administer blood products. The application process for agencies to carry, store, and administer blood will be handled by the Bureau of EMS rather than Wadsworth, which is the way it was done before. And the thought was that would ensure a more centralized, streamlined approach to blood product management. There was mention of contracts and approvals, regional MS councils, contracts being processed, while program agency contracts are still awaiting approval, unhappily. NEMSIS 3.5 is nearly complete. Most EMS agencies now on the new version. Submission failures rates have simply decreased compared to the previous version 3.4. Okay, and we're seeing improved data reporting collection efficiency. It was announced at Vital Signs Conference 2025. We held in Syracuse, New York on November 11th to the 15th, okay, 2025. There's going to be the creation of a community paramedicine advisory panel. The panel is currently in the vetting process. Okay, with plans to hold its first meeting in 2025. This panel will guide the development and implementation of community paramedicine programs, which aim to provide healthcare services in non-hospital settings and reduce unnecessary emergency department visits. EMS for children, still undergoing the pediatric agitation project. The fire department, New York Bureau of Training, has completed the first of 3 videos that will be shared with the committee for review in the future. Finance Committee, there was discussion of how to maximize the use of New York State Division of EMS recruitment and retention funding. Each regional program agency will receive $15,000 over the next 5 years for a total of $75,000 each. Education training, KK had its first joint education finance committee meeting about EMS education funding, specifically course structures and the money available to meet the education standards. There was a legislative regulations committee meeting that mentioned 6 pieces of EMS legislation not yet acted upon, but expected to be renewed in the 2025 to 26 session. I'm not going to mention them here. We can provide you with that information. Safety committee is updating its policy 00.13, operation EMS vehicles, which will be completed sometime May, June of 2025. The committee discussed the height of stretches with patients on board that they could be unsafe due to high center of gravity, which increased risk of injuries of patients and healthcare providers during movement. It was mentioned the issue highlights the need for better educational guidance on safe practices and ergonomic adjustments. Pre-hospital quality improvement webpage, like this is quality metrics committee. The pre-hospital quality improvement webpage has been updated with the current national EMS QA measures. Innovation research committee is developing a document for transportation to the different types of DOH OASIS crisis stabilization centers. These will be guidelines rather than protocols. It can be up to the region to develop procedures for transportations to crisis stabilization centers with the intent of this as an alternative destination. Okay, new business, there were shared concerns about the need for more clarity between protocol changes and education standards. Next meeting is to be held February 26th to 27th, 2025.
One comment, the systems committee has taken it upon themselves, or it was given to them, but to create statewide standards. Okay, what are these statewide standards for? Well, they can't do it for medical because that's what CMAC does. I suspect it's going to be for what operational things, which is something we need to look at. And they've been meeting in between the meeting at SEMS in Troy. They meet on a regular basis. They think it's going to take them 2 years to come up with such a standards, but it's something that we need to look at because
Definitely.
what standards are for upstate may be very, very bad for standards for down here. That's.
Yeah, I agree.
I already mentioned the battle that's going to increase about
Scope of practice.
Any other questions?
Jerry, yes, sir?
Just to clarify, the systems committee, which I do sit on, and the tag that's been going on, what each committee at SEMSCO was charged with was 1 or 2 items that were in the EMS white paper that was chaired by Michael Beninati from Dutchess County. So the portion of the EMS Systems Committee, which is operational and not medical, was centered around operational capabilities, capacity, and ability to operate. So what we started to work on was some key points about response, ability to meet your obligations, inability to respond, mutual aid, other things. The part about the 2 years that the chair just discussed is not for the amount of time it takes us to develop it. It's roughly the time from when we start any reg process, from the development of the reg to it actually is implemented. So our piece on the operational piece basically took 90 days. But once you submit it for reg approval, it goes through obviously a review process, just like the vehicle standards piece that is now coming out, second review after changes. And it does take whatever time it takes. But fortunately, A lot of the committees that are developing interest to move forward based on the white paper have actually been moving pretty quickly. So unfortunately, we can't change government and policy and procedure, but you know, we can just move on to the next project, which we already have, which is 0606. Stay tuned.
Thank you.
Any other comments? Everyone is very much interested in getting out of here before they lock the garage doors. I think the item under new business will postpone to another month. If anyone's dying to be on committees, you can volunteer in between. And motion to adjourn is in order. Have a good, see you in a month. Or on the air if you guys succeed.
Yeah, I'm double.
Yes. He wants to see.